Welcome to Conversations on Healthcare. This week we welcome family medicine doctor and Professor Iryna Voloshyna, continuing to teach and provide care in Ukraine as the war rages on.
Everything is much worse than you ever can imagine.
Now, here are your hosts, Mark Masselli and Margaret Flinter.
It's been a little over a month since the world watched in shock and horror as Russia invaded Ukraine. Over 10 million Ukrainians have been displaced and 3.5 million people have fled the country. This happened faster than in any previous European crisis. The World Health Organization says the only real solution is peace. What do we know and what we should do as we hope for peace?
Here to help us understand is Dr. Iryna Voloshyna. She's a professor in the Family Medicine Department at a state medical university in southeastern Ukraine, which is not too far from Mariupol, where some of the most intense fighting has been occurring. She also serves on the board of the nonprofit Academy of Family Medicine of Ukraine.
Well, Dr. Voloshyna, thank you so much for taking the time to be with us. Maybe you could just share with our listeners where you are at the moment. Are you at your university, and how is your community holding up at this time? I'm thinking particularly about the healthcare providers as well.
Hello, everyone, dear colleagues. Thank you for invitation. And first of all, I would like to express my appreciation for your attention and ensure that I am in safe place now. I cannot say any more, and I would be also grateful not to name that war and genocide in Ukraine in world crisis or conflict. Everything is much worse than you ever can imagine. And the horrible mass murder of civilian population in Ukraine, military disruption of our country, violence, that is now reality in Ukraine. My native communities suffered so much from Russian military occupation, who totally blocked cities with population over 100,000 people. So my patients have now any possibility to obtain life-threatening medication, normal food, and usual human facilities. Of course, our Ministry of Health, international partners and volunteers try to help as much as they can, but more than a month, we cannot send to block communities even any pill.
Well, Dr. Voloshyna, as a medical school professor, I know that you must have trained so many physicians and maybe other healthcare workers as well throughout the country as primary care providers, people who are used to being right there with their patients on the front lines, doing whatever needs to be done. What are you hearing from them? Are they able to be out there caring for their patients, across the lifespan? What are the stories that you're hearing from your former trainees?
Mm-hmm. Actually, you're absolutely correct that we have in Ukraine more than 23,000 registered primary care doctors and twice more family nurses. Me and my colleagues from Academy of Family Medicine of Ukraine and from Medical University really train lots of them, and now we have an extensive network of medical professionals who gives now strong support for our patients and coordinate lots of humanitarian packages. Before 24th of February, I was fully engaged in educational process, and I'm proud to represent Professional Society of Family Doctors in Ukraine. And in this March, we had to provide a big congress with invitation of my primary care colleagues from Athens, from Helsinki medical universities, but our plans were criminally interrupted. So now I give warm greetings to all my colleagues, primary care physicians in Ukraine. Most of them, for example, my PhD student went with weapon now in Kiev. Before this 24th February, we start absolutely new project for Ukraine called vaccination in chemistry. I was in front line of this project. So we were absolutely doctors with peaceful professions, but now we should take weapon and fight with enemy.
You know, Dr. Voloshyna, your world, as you just said, changed so much from a month ago when you were engaged in teaching. And I'm just wondering how your morale and how your spirit of your fellow citizens is holding up. You know, we listen to President Zelensky talk and feel that sense of strength and independence from his voice, but we know you're also living in very difficult times, and we just want to hear from you about how you're able to maintain. It seems that the Ukrainian spirit is one that's very positive, even in the midst of all of these difficulties. Share with us a little bit about your sense of the morale and spirit.
Mm-hmm. I'm not kidding, but my last course I have been taken called stress management, and WHO organized TOT training for future trainers. So I'm I'm a trainer of stress management, and you know now I understand all necessity of such courses like mental health care, stress management, and a lot of my colleagues already have taken this course. So our moral state is quite strong. We try to keep to be close to each other. We have a lot of close social networking groups. For example, I joined the group of my course from medical universities doctors, and we discuss a lot of medical questions. We support one each other. So our moral state I characterize like quite strong, but I worry very much about my patients and about our doctors who are staying now in totally blocked and occupied territories. It is completely awful situation. There is humanitarian catastrophe, and it's real genocide because people completely lost even food.
Well, Dr. Voloshyna, we've been following, of course, the World Health Organization reports that there have been 31 documented attacks, I think, on healthcare facilities with both injuries and deaths. I think we all were horrified by the attack on one of the maternity hospitals in particular. And there's a saying that there's no rules in war, but I thought healthcare was usually spared in terms of direct attacks. And I wonder, as your hospitals themselves are being hit, you know, life-saving places, critical moments, are you feeling that we're on the verge of a collapse of your country's healthcare system? The World Health Organization has warned that that may be the case, but do you see that as imminent at this point?
Actually, let me give a short information what happened before the Russian war. Actually, our health care system was built in very quick terms, and we already have a completely digitalized medical system. We have digital medical records. It was, to my mind, one of the best system even in Europe, because I'm in close communication with my colleagues from even European countries. But believe me, our healthcare system for last 5 years was completely rebuilt, and a lot of fantastic doctors joined the team. Now we have a lot of problems with digitalizing because of very simple issue. In a lot of our districts, we even have no electricity. And that is a big problem, because you have no electricity, you have no internet. So I'm very grateful, for example, to Elon Musk, who gave us Starlink, and I hope that we can join our medical electronic system to this internet system. And regarding the collapse, I cannot say that we are now on collapse level, but we urgently need to make more communication and give more rights, not only Ministry of Health, because there are so many requests from medical hospitals, from other little medical even individuals, individuals who care about their patients. So even our Ministry of Health with international partners are not sufficient. So I would ask to engage our NGO. We have a lot of NGO who can support our medical system, and I would ask every international partners in terms of support of our medical system from different levels to make good communication and support in different ways.
Well, Dr. Voloshyna, that was a wonderful overview of the system. I think there's some comfort in a very difficult situation to know how advanced Ukraine was in digitizing its records. And obviously, we know the NATO leaders are meeting, and hopefully more supplies will be coming into the healthcare system, as well as to support the security of the country. You know, and I wanted to sort of pull the thread on your statement earlier about really concerned about your patients. And we understand even before the war, your country had a very high rate of TB. In fact, one of the world's highest burdens of multi-drug resistant TB. And we know infectious disease spread during mass movements of people. What can you tell our listeners about this part of the crisis that you're dealing with?
Mark, you raise very, very important issue, because really even before this February, the rate of TB in Ukraine was 6 times more than in European Union countries. And I tell it is my message to European country who allowed now for our people to live in your communities. I kindly ask you to open your medical system for examination of Ukrainian displaced people, because in terms of TB, there is a very simple rule. As faster as you diagnose and recognize TB, as faster you get recovery and result, and this person will be absolutely safe for society. I know that those 3 million Ukrainian people who moved now in European countries are very, very hard. It is very hard for them to get medical system and examination in European countries. So please give strong attention in terms of diagnosis of TB in Ukrainian people, because even TB in children in children is also quite high, and also multi-drug resistant, of course. So I hope that you help us. You know the right schemes of medication. You have this medication, so please help our people to treat them.
Yes.
Dr. Voloshyna, I think people really will hear that call. I want to ask you about the people who remain in Ukraine and the supply chain. You know, I think about, I could probably do the math and figure out how many thousands or tens of thousands of people with diabetes remain in the country. For the people who require insulin, you've just described to us a situation where you have large areas with no electricity. You have the issue of getting, I'll just use insulin and people with diabetes as an example. What is being done? What can be done to maintain the vital flow of medicine that is really required to sustain life and other medical supplies to the millions of people who remain in the country?
Simply, it is urgent question now, especially for Kherson region, for several regions of Zaporizhia, of course, for Mariupol, for Chernihiv region, because there are very hard to get the insulin and other vital medical supplies. And also for people with oncology disease. For example, yesterday I received several requests regarding oncology drug treatment, but we can physically give to our people this medication because there is no road, there is only military Russian soldiers who kill everyone who try to bring any box to our people, and that is awful situation. And I can say that, for example, in non-occupied territories like Dnipro, Kiev, the situation is stable. We receive enough amount of vital medical supplies, and thanks again for our partners, because in these months you understand you can understand that any our medical factory was not efficiently to produce medications. So those insulin and other products and drugs were kindly given from the partners. I'm sorry, that's my daughter.
No, that's great. Well, thank you so much for that. And you know, really just thinking about the supply chain for medicine, I also just wondering about the basics of food and water, whether or not nutrition is becoming an issue. Obviously, there's still, as we just heard, young children who have all sorts of needs. Maybe tell us a little bit about the nutrition, but also just the general health of young people. I think we all worry. You mentioned earlier about some of the training, first aid and behavioral health. What do we know about the needs of young people as well?
Our young people, our children suffer so much, you even can imagine this. Actually, my daughter sleep on the floor in the metro station in Kiev almost more than 1 week. Then we slept on the floor in our bathroom, and every hour we have a notification of air alert, and we need to go down to metro. So our Ukraine is living now and have such schedule now. So any school, normal school lessons, any usual activity are not exist now in Ukraine, and I understand those parents who afford to let their children to go to safe place, but there is any safe place in Ukraine now, any. And if we talk about food and water, I can say that even yesterday, our organization, our NGO, sent more than 30 meters, cubic meters of food and hygienes to region of Chernihiv, because there is a humanitarian catastrophe there. People even without usual food, not even to discuss medication. So there are a lot of humanitarian crises in Ukraine now, even near Kiev region, for example, Irpin, Hostomel, who completely destroyed without mobile phones. We didn't know, and we don't have any information what is happening there now. But when we receive even small request, we try to react as quick as we can.
I think it goes without saying that it is hard to grasp the sheer scope of this humanitarian disaster. And Dr. Voloshyna, I know you're trying to do so much, and we're asking you to comment on a wide range of issues, but it seems to me virtually everybody who's in the occupied areas in particular, probably everywhere, but especially the occupied areas, are living in a state of trauma. And responding, as we know people do when they're traumatized. And some people's behavioral health status wasn't as strong to begin with, right? That's just the way it is. I wonder how you and your colleagues are working to maybe deploy additional help and support for people who are experiencing serious behavioral health distress. Are your medical students able to be deployed in a way that is helpful? Your nursing students, peers, you need to make sure that you can triage a little bit, right? What kind of healthcare providers are available to take care of what groups of people? How are you pulling people into this work to provide really mental health care to people who are very traumatized right now?
Mm-hmm. Margaret, the question about of mental health is really acute. Now in Ukraine, I'm not sure if our medical students who only gain their diploma are experienced in giving mental health support. Mm-hmm. But I can say that last 3 years, the World Health Organization provides a series of training as for primary care physician in most of region in Ukraine. I was one of the trainers. We have a strong support from our psychiatrists and psychologists. They also quite experienced. Our social workers also have been trained to mental health program. It is so-called mental health gap. Maybe you know this guideline. So we try to give our consultation to our patient according to this guideline, but I know that the request, for example, for retired homes from hospitals in small villages, very, very high and intense in terms of psychotropic medication. For example, diazepams and other medications which can be prescribed during acute stress and psychological trauma, and for people in deep depression. So, of course, we need to combine as pharmacological treatment as non-pharmacological treatment as well. And I hope that we could give it to our people.
Mm-hmm. And just one last question. I'd be interested to know, prior to the war, COVID pandemic was raging across Europe, and certainly the Ukraine faced the same crisis. What can you tell us about the status now in terms of the ability to assist people, or what the rate of spread is at this point, or is it too difficult to assess?
For us, because I even in the night send to my patient electronic receipts and electronic referral to specialists for examination. So system is working now, and of course, regarding if we talk about COVID as a disease, of course, there is, I think, it is non-countable at all, as well as the rate of vaccination. But before war, the rate of COVID-19 vaccination in our country was quite okay. It was over 15% of target population.
Great.
Well, thank you, Dr. Voloshyna. You have truly given us a window into the challenges you are facing, and our hearts and prayers go out to you and all of your colleagues. And thanks to all of you for joining us today. You can learn more about Conversations on Healthcare. Sign up for our email updates at www.chcradio.com. Thank you again, Dr. Voloshyna. We will be thinking of you in the days to come.
Yes.
Thank you very much for the invitation.
Thank you. And best to your daughter.
Thank you.